Hi, I'm Carrie Elizabeth Lynn. I'm a licensed professional counselor and I also have bipolar disorder myself. Today I'll be talking about bipolar I disorder, which is the kind I have. So, a diagnosis of bipolar I only requires one manic episode. However, in the vast majority of cases, it involves both manic and depressive episodes, as well as hypomanic episodes. There's a great deal of variability in what episodes look like and in the course of episodes over time. Treatment for bipolar disorder needs to be individualized in order to be effective, so it's important that mental health providers understand the specifics of a particular case. Some of these specific differences are listed in DSM as specifiers. These specifiers also apply to bipolar II, but I'll go over them here. First off, if you're having a manic or depressive episode, it's specified as mild, moderate, or severe, depending on the number and seriousness of symptoms. Hypomanic episodes are by definition on the milder side, so severity isn't specified. And then if you're not currently having an episode, you're considered in remission. Full remission means you haven't experienced any significant symptoms for at least 2 months. And partial remission means you're experiencing some ongoing symptoms, but not enough for a full episode, or you haven't experienced any significant symptoms for a period less than 2 months. And then these next ones I'll mention are used to describe characteristics of a particular episode, and keep in mind that several may apply. First is mixed features. I went over this one in a previous video because I wanted to include it in the part of the series where I described manic, hypomanic, and depressive episodes. But briefly, it's where you have a combination of both manic or hypomanic and depressive symptoms in the same episode. Next is anxious distress. This is where you have anxiety symptoms along with a mood episode. For example, you fear something awful might happen or that you may lose control. Next is melancholic features. Melancholia involves a distinct quality of depressive symptoms, including a loss of pleasure in activities and an inability to be cheered up even for a little while in response to something positive. Next is atypical features. This involves a different quality of depressive symptoms, including being able to be cheered up for a while in response to something positive, a feeling of heaviness in your arms and legs called leaden paralysis, and a lifelong pattern of being very sensitive to rejection by other people. Next is catatonic features. Catatonia is a serious condition where someone becomes unresponsive to their surroundings and displays a variety of psychomotor symptoms. For example, someone who's catatonic may not move or speak for long periods of time. And psychotic features. This is where you have psychosis as part of a manic or depressive episode. That means you lose touch with reality and experience delusions and/or hallucinations. This one doesn't apply to hypomanic episodes since, by definition, they don't involve psychosis. And then these last ones I'll talk about are used to describe the onset of an episode or the course of episodes over time. The first of these is peripartum onset. This means an episode came on in pregnancy or up to 4 weeks after giving birth. Next is rapid cycling. If you have 4 or more episodes of any kind in a year, then your bipolar disorder is specified as rapid cycling. And finally, seasonal pattern. Some people have a consistent seasonal pattern to a particular type of episode. For example, a common pattern is depression in fall and winter. So that wraps up what bipolar I disorder is and some of the ways it can present itself. The main point I want you to take away is that symptoms vary greatly from person to person, and it's important that people with bipolar disorder get individualized treatment. Thanks for watching, and here's to good mental health.